Hello, and welcome to another episode of Insights. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Our hope is that these episodes serve as a resource for the advancement of your career and the continued success of your team. Now, on to the show.
Today on Insights, we go back to a conversation host Bill Russell had with Mike McSherry, the CEO of Xealth. The topic of discussion was how digital engagement with patients leads to better quality care experiences and outcomes. And Bill and Mike discuss what digital health means for patient education, decision-making, and the quality of the care experience.
In our definition of digital health, it spans from patient education to shared decision-making tools to apps that manage diabetes or hypertension or behavioral health, as well as the facility of prep and recovery. So when you talk about quality, in many cases, we're sending out pre-surgical educational material or pre-surgical digital pathways. Stop eating here, stop drinking here, make sure you bring this to the hospital system, make sure you have this at home on the recovery pathway. And so that addresses quality, even though it's a digitized patient education experience. So is that digital health? Maybe not in the quote app-based world, but it is digital engagement with the patient that's leading to better quality and outcome measurements. So that's one definition. We've got data showing behavioral health. SilverCloud is a behavioral health app. We've launched that at 3 different systems, and we're enrolling about 2/3 of all the patients who've ever been prescribed that app actually adopt the solution, and then 75% of them are showing improved PHQ-9s. So that is definitely an outcome and quality measurement metric against that. We do an awful lot in maternity care, and in maternity, highly expectant mom, highly engaged against her care and the newborn child prep, the sort of what to expect when you're expecting on that level. What we're trying to do is correlate how much is in light of telehealth, that all needed to have device accompaniment. So how is the blood pressure, cuff and scale weight of the mom tracking against her healthy pregnancy, so that otherwise healthy mom checkup can be done in a telehealth experience with that added device diagnostics. So that's leading towards quality outcomes. We try to correlate that directly to low NICU events or reduced low birth weight events. But quality scores solely based on digital engagement is the only kind of attribute is probably a little difficult against all the other social determinant and other kind of considerations associated with that mom and the healthy birth of a child.
So that's quality. When we look at experience is one of those areas that's really in the wheelhouse of a digital solution, a digital set of tools. Have the habits, have the demands from the consumer changed, do you think, over the last year to say, look, digital first? From a safety standpoint, this is what I was hearing when I was talking to people. They were happy with their online visits. They were happy with remote monitoring for chronic conditions. And the reason they were happy is because they were told that it was unsafe to go to the hospital. And so they found a solution that they felt was more safe. But after doing that for 9 months, do you think that changes a behavior? Do you think there's going to be more engagement from that perspective and conversely, a better experience all around?
Absolutely. We all talk about the consumerization of healthcare, and we can all do mobile banking transactions. We can book flights on our phones or websites, et cetera. So much of your consumer life can be transacted digitally. But when you hit the healthcare world, there's phone calls, there's faxes, I jokingly call it the lowest common denominator. Hospital systems like, well, if 100% of people can't do something on their phone, then let's go to the lowest common denominator and make sure everyone makes a phone call or comes in for a face-to-face visit. And that does not meet consumer expectations. They can so easily transact in their consumer life against every other element of life digitally. But in healthcare, it sort of hits this analog experience level. But that's changing, and it transacts with booking an appointment. I think almost in most scenarios now, you can book appointments with digitally, but maybe not that specialist referral. That has to be a phone call that transacts with that. And then all the way through to the patient experience, whether it's done telehealth or virtually, and then the resulting, care protocol and treatment, and whether or not the person felt that they had a successful outcome. When you look at that whole transaction experience, compare that with, like, say, Uber. The magic of Uber is press a button, phone shows up, you leave and you don't have to give cash or pay a credit card or, deal with that 2-minute delay climbing out the taxi while you're in a rush to go do something. But the ride itself is kind of hit or miss. Am I going to want to talk to the driver? Am I going to trust the driver? Is the car going to be clean? Especially in this kind of COVID pandemic, who was in it before? Is my mask safe? All that level of uncertainty. Compare that with the patient experience here. The pain in parking and navigating through the walls of a hospital system and just getting there in the waiting room and lobby, your little 15-minute window with that hospital system, with the doctor, with the nurse, that's magical. Everyone loves it and says, oh, I had a great visit with my doctor. But boy, it's such a pain on the front end to book and transact and get to that appointment. And then upon leaving, like you're handed a brochure full of papers, or go here to get that, or make this phone call to follow up on that front, or it's an opposite end of the experience spectrum. And what healthcare needs to do is solve that magical middle and the bookends to create a seamless, consumer-friendly experience to that patient care.
It's interesting when I talk to some people, they were implementing Wayfinding to make it easier to go through. I'm like, well, step back one step from that and figure out a way to make it so easy that they don't need Wayfinding. And they sort of looked at me like, what do you mean? I'm like, well, do you remember that? I don't know if you remember this, but a CVS CMIO once talked about, they were putting Epic in. He goes, why are you putting Epic in? And it was a health system executive who was asking the question. He said, do you think you're going to be able to compete with health systems? And he said, yeah, I absolutely think we're going to be able to compete for some services with health systems. He said, well, why do you think that? He goes, parking. That was the whole answer. I thought, yeah, that's true. Parking is one of the biggest complaints of going into a health system. The campus is big. It's hard to find where you need to go.
Yeah. And that just devolves even further to just convenience, and convenience spans a whole range of activity and interactions.
Are health systems going to be able to start to really differentiate with each other, against each other potentially, and differentiate in their communities based on a set of digital tools?
Well, I don't know if the question so much is health systems differentiating against each other or against the new entrants and new competitors.
Yeah, that's probably a better question.
There's going to continue to be consolidation in the U.S. provider industry, I think, and rightfully so. You don't want too much density in a single market, et cetera. But take a look at the two biggest systems, not-for-profit, Providence and Ascension, both probably do $25 billion a year in revenue. What did United Optum do? $250 billion? National scale, 10x the revenue, frankly, 10x the profit probably. So they can just reinvest in these convenience, these digital platforms, these behavioral elements. And so I think that's the differentiation that hospital systems are going to have to do, is how do I remain viable and not viable. There are always going to be entities, the acuity, the ED, infrastructure and that element. But is a lot of the low acuity and chronic care going to get siphoned off to these more virtual solutions and payer kind of directed solutions? And with payers even kind of building a lot of, clinics, they don't have to do the high acuity surgery centers. They can just focus on the chronic care, which is the bulk of the cost in the country. And if they're so acutely managing steerage on that front, the unnecessary surgical procedures and the MSK before the spine surgery remediation, those types of opportunities will certainly hurt the finances of hospital systems. So if I were hospital systems, I don't know that I'd be looking at my neighbor across town as being my competitor. I'd be thinking 5 to 10 years down the line, how am I more effectively competing against these payers and new entrants to have skin in the game and maintain that patient relationship? And as we just discussed earlier, I think there's going to be a 60-40, 60% still going to be the in-person care, and 40% is going to go virtual. And if you use those numbers, the hybrid model wins, but you have to have the seamless experience that bridges between telehealth is appropriate for XYZ, I'll go in face-to-face for this procedure or, this annual wellness visit or whatnot. But if you can't seamlessly intermingle those two different dimensions for ease of consumer and patient convenience, you're going to risk losing all of it.
Wow. Thanks for tuning in. Another great episode. If you have feedback for us regarding this content and materials, or if you would like to help us to amplify great thinking to propel healthcare forward, which is our mission, please send us a note at hello@thisweekhealth.com. Thanks for listening. That's all for now.